Okay, so picking back up immunotherapy, the most important thing here is that they are on a great medication management routine. So you guys can assist with that. You can help develop a pill box or a chart or schedules, any kind of system that works for them. But it's important that they have really good structure and routine for that. Okay, with the hormone therapy, things to expect here, kind of probably what you would expect: hot flashes, mood swings. So differences just up and down with their hormones. Okay, transplantation. These clients will be in isolation. So my experience with this is that we had a patient that was going to do this, went to Vanderbilt, was in isolation for a long time while he was undergoing the transplant. It was actually um, it was bone marrow transplant, and so I want to say for like a month in isolation. So long time will be in isolation. So this would be more if he was on your floor in acute care, not so much in any other setting. Okay. Also to note here, since the immune system is compromised, right? We are treating these cancer cells are being treated. Any kind of infection, something that you or I could normally fight off, these folks could find detrimental. It could be deadly. So hand hygiene, super important. Clean all your stuff each time. Stuff that we're doing every time anyway, but really, really critical in the oncology population. Okay. All right. Now specifically for rehab. So for pre-op, this is kind of one that you may not think of so much. Whoops. Just trying to move that around. Okay, so for pre-op, you're going to be doing education with your patient, the family, and it's going to look like education of what this disease course is going to look like for them. What kinds of things are they going to need after their surgery? Are they going to need a tub bench? Are they going to be able to shower? Are they going to need full assistance? Are they going to be more fatigued? These are all kinds of questions that they may not know with this new diagnosis and after this surgery, that you can kind of help them to plan ahead and to know what to expect. So you're kind of trying to look at their functional expectation then. Like I said, at this point, you might be ordering some equipment that you could expect with the increased fatigue and the things that you know that they may experience. Following that post-op, so biggest thing here is that, and I put an asterisk there so you guys know that postoperatively the precautions must be followed. So whatever kind of surgical precautions that surgeon has put on this patient, you follow those by the book. Really, really, really get clarification if you're not quite sure what that means. Check with the nurses, check with the physician, because each one is so different. This is not where we just have our standard precautions like we do with our hip or sternal precautions. These are going to come with just a different case by case kind of scenarios, right? And so that's the biggest thing to think about, is to make sure that you follow the specific precautions. So, for example, to that, if a client has had maybe breast cancer surgery, maybe they've had a lumpectomy or something similar, they may have precautions similar to sternal precautions. So that may be something that you would need to look out for. It may present similarly to hip precautions, depending on what area of the body is affected, or could result in weight-bearing precautions. So maybe if they had some bones or joints that are affected, perhaps weight-bearing precautions. Okay. Other things that you'll want to monitor would be the labs, the hemoglobin, platelets. If I have somebody that's low on platelets, I'm not going to have them be shaving or doing high-risk activities, right? Because that's going to cause them to be at an increased risk of bleeding. And I just don't want them around sharp objects, right? That doesn't make a lot of sense, okay? So first, we do no harm, right? So choosing our activities wisely. As far as convalescence, so convalescence just means time spent recovering from the illness, right? So this is more your traditional phase of rehab, all the typical stuff. You're going to look at their motor, their sensory, but also think about the psychological support. How are they coping? What does their body image look like now? What is their social support going to be like? Do we need to help them in all these other realms? Are they dealing with depression, anxiety? Are they feel fearful that this cancer is, even if it's been removed surgically, are they fearful that it can return? What is their process, and how are they dealing? How are they coping? So, in addition to our more typical things that we think about, also consider those psychosocial concerns. Okay. Following that, the palliative care. And palliative care can occur simultaneously with our treatment, but the focus there is going to be on pain relief and quality of life. Okay, so similar to hospice care, but they can still be going through some of those treatments. So as far as hospice or end of life care, biggest focus here is quality of life, and we've talked about this before in our other classes. But as far as interventions that we can have a role in, and this may be as we're discharging them from a home health or from a skilled nursing facility into hospice care, or more directly, more hands-on. So trying to provide the client with as much control as possible during this end of life. We're going to encourage planning for their death, just like we've talked about from the Being Mortal book. It's imminent, it's coming. How can we help them and their family to be as prepared and at peace with it as possible? Some interventions that you might think about would be journaling, like journaling their feelings, celebration of life, and just maybe reminiscing over all the good times that they have been able to have, right? Scrapbooking, letter writing, and the letter writing could be to reconnect with loved ones, or helping them to set up phone calls with people that they maybe feel like that they're not on great terms with, that they want to finish up some things before they pass. So those are things to think about, and that's kind of your scope of the rehab process when dealing with oncology folks, okay? And then one final thing that I want to offer here is that, again, whenever you are on both sides, whenever you are treating and when you are taking your test, you need to consider what stage they are in and which phase of rehab they're going to be most appropriate for. Okay, so somebody that's at a stage 1, an early stage with one of those real good survival rates, we're not going to be talking about end of life care for them. That doesn't make sense. Okay, and then on down, we need to be able to kind of fit them into what would be appropriate. The reason that we can't tell you do this for this patient is because there are so many forms of cancer. But treatments that you would be looking at would be a lot of the fatigue related. So similar to activities that you would be doing for limited endurance, and for our maybe our cardiovascular COPD type clients. Those might be energy conservation techniques, things like that. They may need help with that. They may need compensatory strategies for new ways to dress, new ways to do things that they were able to do before. And then also adaptive equipment can be useful here. So it's one of those things where you're just going to have that therapeutic use of self. You're going to go in, do the activity analysis part of your evaluation, and say, you know what, this is what is limiting them now. And then do we think they're going to be able to regain that, or do we need to compensate? Okay, so wrapping that up with oncology, it's important. We can have a good role in it, but be sure to take in the full picture, their support system, their cognitive state with it, and how they're just doing overall as well as physically. Okay? All right, guys, that's it for today. Have a good one.